15 weeks today.
15 weeks today. How you feeling?
I'm feeling great.
So for those, if there's anybody, maybe one person watching this video that doesn't know Margot, Margot had her surgery. She had a brow lift, upper and lower eyelid surgery, deep plane extended lower facelift, deep neck lift, full face laser resurfacing. Am I missing anything?
Oh, I was kind of nervous, so I didn't listen to you. I didn't hear what you said.
And it's been about 15 weeks ago. And how old are you, Margot?
I'm 58.
Okay, super. Tell me how the last time we saw you here in person was about day 10, roughly, since after your surgery, right? So it's been about 3 months since we saw you here in person. Yeah. Catch us up. How have things been going?
Oh, everything's been great. The big, not concern, but my lip. Obviously, I think everybody wants to know, and it's working fine.
We'll show them how your lip's working. So this is not uncommon. I'd say about 1 in 30. I've had people where, maybe a little more than that, maybe 1 in 20, where temporary weakness of the smile or lower lip or something like that. It's just kind of par for the course. So far, they've all woken back up. The time course for that, anywhere from 3 to 6 months is kind of on the outside. Sometimes it's sooner. You were sooner. You started waking back up within a few weeks. Right? Yeah. But the vast majority, we actually know we can see that part happen. Eyes. Tell us, you were just telling me about, you had some concerns about your eyes at the beginning.
A lot of people know that I was a little bit upset about my eyes just because I didn't really recognize myself. And I knew it would take time, and I talked to people. I didn't talk to you because I knew I just had to wait it out, and they're great.
Yeah. I think they still look like you, but just without the bags and the upper lip. But at the beginning, you said that they were too small. Well,
I always had hooded eyes, so that's the big difference for me because they are definitely not hooded anymore. So, and it was an adjustment.
And then also, you felt like you were the aperture was small, right? Yeah. I think you said it reminded you of Kevin, or maybe you told me that part of it.
My son told me that I looked like I was stoned. So.
No, you weren't stoned.
No.
But turn towards me. She's got a tiny little, actually turn diagonally into that. Tiny little patch of broken blood vessels right here. We're going to laser those today. That's not uncommon. We used to see more things like that, but with this limited delamination, smaller skin undermining, we see less and less of it. And the only tiny bit she has is just maybe 8 millimeters by 7.5, just the tiniest little bit there on the right side of her cheek. How have people in your day-to-day life reacted? Has anyone noticed?
No, really not.
Isn't that crazy?
Yeah, the comments are funny because the comments online are funny. They're like, people will not recognize you, and you have that fear. When you first go meet people or go to work, you have such a fear that they can't even know it's me, and nobody even notices. Yeah. So,
well, you're one in particular that had so many comments about that's not the same woman. Her ears are totally different. We can talk about that too.
Still saying it.
Different ears. That's not her. Can't be the same woman. How would you address those?
Well, my ears are back to how they were in the beginning.
So at the beginning, it's very common. I don't want to see pixie ears at the end of when people are healing a few months in, where it's stretched out and looks diagonal and attached and looks weird. So at the beginning, we have to almost crowd the earlobe just a little bit, and so they might look a little more detached, and they also swell, so they can look a little plumper than before the surgery. And so between those two, if you have someone like Margot that's got basically an attached ear, at the beginning when it's crowded and plump, it can look kind of like my earlobe, kind of detached or a little bit fuller. And I think that was probably the most common troll comment was, I know it's not her, one, because it's the degree of change. But then, two, you can tell because of the ears. And I saw that. How many languages did we see that in? We saw it in French, we saw it in Spanish, we saw it in German.
Yeah.
And everyone thinks they're slick because they put it in a foreign language. Like, you just hit the translate button right under there to tell us what it said.
They also said that my eye color had changed.
Oh, yeah. Tell us about that.
Well, I noticed it too, actually, in photos right after surgery. I don't know if it's just because you're swollen or what's happening. Maybe you can explain it. But and Lisa also said she had the same thing. My eyes did look a different color with the right lighting on it. So
yeah. I think some of it, as you said, some of it's lighting as well, because even maybe say with the eye aperture being a little different, you're not getting the light coming at the exact same angles. That might be a little bit part of it. But,
yeah.
Good. Well, turn towards me. We'll take a look what you look like. So incision lines, let's look over those. So this is pretty average for 3-month incision lines. You can see your hairline incision. I'm going to turn you a little bit to that direction. There you go, good. A little bit of pinkiness still left at the ear incisions. Turn a little bit more this way. A little bit of pinkiness still left in the behind the ear incisions. Sure, let's go a little bit towards me again. There you go. Behind the ear incisions, that looks all perfect. Brow lip incisions. Let's have you look down towards your left foot. There you go. There's one. Basically gone. Let's have you down look towards the other foot. The opposite one, basically gone. How about the helmet head? Are you feeling that at all?
I was really interested by that because I did not. I had helmet head for maybe 2 days.
Yeah.
I didn't have it. I had the pain, the sensitivity, but I really didn't have that helmet head. So it's interesting how
Very
different
variable.
everybody is.
Very
Yeah.
variable. I've had patients 2 days. Peggy is another patient that I've featured recently. She had it for less than 9 weeks. I've had other patients that it's still 6 or 9 months and it's still coming back. So it's very variable. And then you're tender when you sleep on the side of your face, you're saying. Tell me about that.
Yeah, I have. You always talk about the numbness, the 3, 2, 1 finger, and I definitely could feel numbness in the side of my face, but I still have all of this is that sensitive, like pinprick, like sore to the touch, and especially if I go have the lymphatic massage right here. If they massage there, it's too much. So it's still very sensitive.
Yeah.
But I never really had anything under there, just like Peggy said.
No pain in it.
No.
Yeah. So that's pretty consistent. Whereas nerves are working back up, they usually go from numb eventually to normal. But in the middle, it's very common to have kind of mapping problems, like you touch over here and you feel it over here, or sensitivity, where what light touch feels more like pinprick, or pressure feels more sharp, or feels burny, or something like that. Would you say something like that?
Yeah, it feels like pinpricks.
Well, what else would you like them to know? You're 3-ish months, 15 weeks to the date, practically. What else?
So I think it's interesting. The question that I get most is, would you do it again? Do you regret? And of course not.
Of course you don't regret, or of course you wouldn't do it again.
Of course I don't regret it. And of course I.
We got to clarify for because people be like, she said she wouldn't do it again. Yeah, you look awesome.
I was thinking, it's like, why are so many people asking me that? But it's their apprehension. They're thinking about going through surgery and they're like, should I do it? Should I not do it? But I would say, make sure you pick somebody that you trust.
It's a lot to go through. One other thing I want to ask, you made this comment here and there too. Looking younger versus looking better afterwards.
Yeah, so everybody will say, oh, she looks 30 years younger. She looks like she's 20 or 30. I'm not talking about me, but all of your patients. Or she looks like her daughter. And, if you actually looked 20 or 30 years younger, people would look at you like people would notice and be like shocked. But they just think that you look good. I don't want to look like a 20-year-old. I want to look like a really good-looking 58-year-old. So that's why I always kind of correct, like, younger isn't necessarily better.
Yeah.
We just want to look good for our age.
I think a lot of us just want to, and this is interesting because you were saying you didn't recognize your eyes at the beginning. People don't recognize aging changes. Aging changes make you look different. You don't look like yourself. And really pretty surgery doesn't look funny. Aging changes can actually make you look like you're mad when you're not mad, like you're sad when you're not sad, like you're tired when you're not tired. And you look in the mirror and you don't recognize yourself. And when I was in my 30s doing this job, I was like a veterinarian. Like I couldn't understand what people were going through. It was like a male OBGYN. Like, it's all clinically in our head, but we don't get it. Now I get it.
Yeah,
So,
exactly.
Yeah. Anyway, well, thank you for coming back. You are amazing, and you've helped so many people with being so candid and being so just open and being so just being Margot. You've helped so many people. I really appreciate it.
Well, like Peggy said, I will take any questions. You can find me with my name probably online, and I'm happy to help people. It's been a lot of fun.
You're amazing. Thank you.
Thank you.
I really do appreciate it.
I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.